But she's very living example of being in a setting and maintaining her, integrative approach. And because it's very nice for us to develop a small little place of our own, because nobody bothers us and we don't bother nobody other than bears and things of that nature. But when you're really at the interface of a hospital setting, where the usual medicine is being practiced, be able to have developed a space and a time and a presence is far more noble, far more creative, and far more effective. So that's one part. The second part is that she lives what she talks about. So she walks, and she talks, and she has a breakfast in nice places. And that's kind of very nice. Some of us know that she spoke at our, the annual conference as well. Very data driven. Because science is not based on what my good thoughts, feelings are. They have to be data driven and also based on good projective ideation. So our past knowledge can give us some idea of how we can proceed into the future, and what the trends are, and those kind of stuff. So it really is truly a privilege for Betsy to be able to spend her time with us, and we take it very, very, seriously. That means we enjoy it. And so with that, I'll let her speak her mind.
So I was asked to talk today about what the role is of integrative medicine in, sort of traditional hospitals and clinics. As Dr. Chowdhury said, it's different here where you can create the setting exactly the way you want it. In a hospital, we're dealing with a lot of other issues, and anyway, so I'll talk about what we've done and what we're sort of looking to do going forward, because there are a lot of things going on right now in medicine in general, and particularly as it relates to integrative medicine. So I think that most people here know about what we mean when we say integrative medicine, but that is a term that was coined by Andrew Weil, and to me that refers to two different ways of integration that actually are occurring at the same time. One is that you're integrating complementary approaches to health and illness along with conventional medicine, not one or the other, but you're applying both. And the other is that you're trying to integrate all the aspects of a person, mind, body, spirit, and so you're not just dealing with the physical problem, but you're dealing with how their thoughts and feelings and how their psychosocial situation and how all the things in their life affect health and wellness for them. So our program has been at Allegheny General Hospital for quite a while, since 1997. And what we currently offer, just to give you an idea, I'm not here marketing my program, but just to give you an idea of what we offer in a hospital-based setting. For our inpatients, we have a free volunteer-run Reiki program. So if you're an inpatient at AGH, you can get free Reiki treatments from our personnel. And we also have a free pet therapy program. We, on the outpatient side, offer acupuncture, massage therapy. We have a psychologist who has a holistic emphasis and can teach people relaxation training. She can teach biofeedback training. She does various forms of holistic psychology, like Gestalt body processing and other things that I don't even completely understand, but that are just different than the kind of traditional talk therapy that has been done in the past in psychotherapy encounters. We do a lot of community education. That's a big role of mine. I go out into the public frequently talking about a number of different things that are related to integrative health, what complementary therapies are and how they can help people, the mind-body connection, and increasingly talking a lot about lifestyle behaviors and how those influence health and disease. Now, I think that it would be fair to say that until recently, in the conventional medical environment, integrative medicine has been something that people think of as, kind of a nice add-on. It's nice to have that. We like to be able to offer that to our patients, but it's really not been considered something that is essential to the treatment of the person. And I think that is actually starting to change. I think that integrative medicine is starting to achieve some level of legitimacy amongst conventional medical environments. For instance, our program is part of a group called the Consortium of Academic Medical Centers for Integrative Medicine. It's a really long title, but it's basically a group of some of them very impressive academic medical centers that have integrative medicine programs and have sort of tried to, get together to pool their collective wisdom, to, pool their experience, and even potentially we hope to have some, administrative and political power to drive the way things happen. Besides our program, other academic medical centers that are involved are places like Harvard Medical School, Yale Medical School, Columbia, Tufts, Johns Hopkins, UCLA, the University of Arizona, where Andrew Weil is, and my alma mater, the University of Wisconsin, where they actually have a really nice integrative medicine program, which they developed after I did my training there. So I didn't get to experience it directly. But now I think there are several changes occurring in American healthcare that I think are really going to help drive the importance of integrative medicine going forward in the way things are done in a lot of different areas. And I think what's going to happen is instead of having separate integrative medicine centers within a hospital or clinic setting, eventually these kinds of approaches are going to be integrated into the way care is delivered, wherever it is that you're getting service within a hospital or a clinic, and whatever it is that you're coming in for. I'm sure that you're aware of some of the changes that are occurring in healthcare in this country. First and foremost is that I think it's being more and more recognized that American healthcare is failing in its mission because although we spend almost 20% of our gross domestic product on healthcare, we rank last among 11 developed countries in terms of, access to care, the quality of our care, the efficiency of our care, the equity of our care, which becomes kind of a moral issue. And we also rank low overall in terms of the health of our population, and even for things like infant mortality, which we think of as third world problems. But right now the United States infant mortality is lower than some countries in like some Baltic states. So we really are just not achieving a level of quality that would be consistent with the amount of money that we spend on it. It's also becoming apparent, with no disrespect to the previous speaker, that we are a nation that is massively over-medicated, and for the limited quality that we get, we pay enormous sums of money for medications that in some cases are minimally effective or not effective, and we have people walking around in society that are just completely over-medicated and unable to function doing the things that they want to do. And that's not only a problem for them, it's a problem for the people that they live with, and it's becoming a problem for the nation as a whole, not only because of their inability to do the things that they need to do to be productive human beings, but because these medications leak out into the rest of society. And we know here in Pittsburgh how much of a problem that is with people overdosing on pain medications or heroin that they're led to originally through the use of pain medications. It's just a huge problem in our country, and it's becoming so apparent that we can't continue to have a society that's over-medicated to this degree. That means that we need to develop non-pharmacological methods of treatment for a number of different conditions. It's also becoming increasingly apparent that most of the diseases that afflict Americans are related to poor lifestyle behaviors. Most experts would say that at least 85% of the conditions that people seek treatment for are related to poor nutrition, lack of regular exercise, unmanaged stress, and smoking. And so really that would tell us that 85% of the things that bother people are preventable diseases that we could eliminate if we could convince people that they should live their lives differently. And in the past, medicine has been almost uniformly unsuccessful in affecting behavior change in patients. And I will say, and I'm sure that you know this here, that's a very difficult thing to do. And so I think anyone would have trouble trying to affect behavior change, especially because the environment that we swim in America is a very unhealthy environment. We're surrounded by bad food choices. We have lifestyles that do not allow us to exercise because we work long hours. We're working even after we go home. We live far away from where we work. We live far away from where we need to go for food and services. So we're always driving. Our jobs are primarily sedentary in a lot of cases. And everything that we do is just stressful all the time. Our reliance on electronics, which are supposed to be making our lives easier, are actually overstimulating us and causing us stress in new ways that even we had thought of a few years ago. At the same time, we don't have the same ability to vent the stress that we have because we don't do the same kinds of things that people did years ago, like connect more in communities and share things in religious and spiritual communities, and we don't dance and sing and do things that people used to do on a regular basis, many years ago. So I think it's becoming apparent that these lifestyle issues are really important and that we need better ways to coach and work with people to get them to affect lifestyle changes. We also need to help them develop ways to manage their stress in the kind of environment that we live in. And, if you haven't heard anything about the Affordable Care Act in the last couple of years, you've been living in a cave or in a coma, and whether you think positively or negatively about it, the one thing that I'm very hopeful about regarding the Affordable Care Act is that its language is pushing care providers toward a model where instead of just being paid to do stuff to people, they will be paid based on how effective their treatments are. So the model is going to be that your rate of reimbursement will depend on your outcomes. If you consistently achieve good outcomes with your patients, your reimbursements will be higher. And if you don't consistently achieve good outcomes with your patients, your reimbursements will be lower. It's a pay-for-performance method that I think is badly needed in medicine because now all the incentives are to just keep doing things to people whether they work or not. So I think that for all these reasons, even people in the most traditional, conventional medical settings are starting to look for different kinds of options, and it's becoming increasingly apparent that integrative medicine approaches are part of the solution to that problem. Over the last few years, as a person involved in integrative medicine at my hospital, I've been asked to participate in, planning and being involved in programming for almost every area of the hospital: cardiology, palliative care and hospice care, oncology or cancer treatment, internal medicine, orthopedics, neurosurgery. They all want integrative medicine to be involved in teaching their residents and students, in teaching their medical staff, in conferences that they put on for other providers, in team meetings to discuss patient care. So increasingly, our program is being asked to be a part of those areas. Again, our role starts out small, but I think it's growing, and I think that we're starting to have more importance in all of those different areas of medicine. Research is, unequivocal at this point in telling us that the psychosocial background and the social factors that a patient is dealing with predict their health care probably more than anything else, more than genetics, more than their access even to care, although access to care is part of the socioeconomic milieu that affects health. And so people, as I've said, even in the highest levels of traditional healthcare, are realizing the way that they will generally put it is that behavioral health needs to be an aspect of all forms of healthcare now. The way I interpret that is we need to be looking at more than just the physical problem. And I think that recognizing that addressing someone's depression if they have diabetes is a part of the care, addressing someone's anxiety if they have heart disease is part of the care. Again, I think people are finally starting to realize that these things are important enough to affect how people do, no matter what kind of treatment they're offered, and that we need to address those things. I've been very pleasantly surprised that our program over the years has gotten very little pushback from our medical staff. I think that if you speak about integrative medicine in a fairly straightforward and rational way, it makes sense to almost everybody, and we've had very little resistance to the things that we've done. I think that we've always had to be a little bit careful about what kinds of programming we offer in a hospital-based program. We tend to try to offer things that do have an evidence base to them. And luckily, there's so much more of that available now because so many more complementary therapies have been studied and have a research background. You probably know that the National Institutes of Health now has a separate area called the National Center for Complementary and Alternative Medicine, and they have a budget to study complementary therapies, and so there have been more forms of research that have been available, and more people in the medical community are aware that there is an evidence base to most of what we do. I'm hoping that the more lagging factor, which is insurance coverage for some of these therapies, will be catching up before too long. Our hospital system has now become part of Highmark, which is a medical insurer, and there are other groups like that nationally, and even in our region. UPMC is not only a healthcare provider, but they are an insurance provider as well. And I think that when those things are linked, it's even easier to make the connection between good care that ultimately leads to less care in the future, as opposed to bad care, which just continues to result in more and more care and more and more cost. So I think that increasingly what I think will be seen is an environment where in the beginning we may get insurers to cover certain types of complementary treatments for certain specific indications where there has been research to show that it's been helpful. For instance, we've known for many years that acupuncture is incredibly helpful for treating nausea from many causes. It can treat nausea that occurs after surgery, it can treat nausea related to pregnancy, it can treat nausea related to chemotherapy, and there's good evidence to support that. And so eventually I would like to see insurers being willing to cover nausea or to cover acupuncture for treatment of those conditions. And in other cases where we have evidence to support the use of a complementary therapy, I think that eventually we may be seeing insurance companies willing to cover those things. Because right now, and especially in this marketplace where there are not tons of people who have lots of extra cash to pay for things that aren't covered, it is difficult for some people to afford complementary therapies, and we don't want it to be a situation where it's only available to people in higher income brackets. I would sort of summarize what I think the major roles of integrative medicine are within the larger healthcare community as the following. I think that it's up to integrative medicine to make sure that everyone in healthcare understands the importance of stress in its relationship to illness and disease, and to help develop ways of dealing with that within all care settings. I think that it's up to integrative medicine to make sure that everyone in the healthcare arena appreciate the importance of addressing the whole person, mind, body, spirit, and not just the physical problem. I think it's imperative that integrative medicine lead the way in demonstrating to the rest of the healthcare community that lifestyle behaviors are incredibly important to health and wellness, and that we need to develop more effective ways of helping patients or people who aren't patients yet develop the kind of behaviors that will make them well throughout their lifetime. I think it's also up to integrative medicine to make sure that people in other areas of medicine are aware of what complementary therapies are available, what research would indicate that they're helpful for which conditions, and also identifying which providers in the community are really providing the best quality care in those areas. And the other thing, which I think is incredibly important, is that I think it's up to integrative medicine professionals to make sure that the healthcare environment becomes healthier for the people that work there, for the people that are taken care of there. Right now, healthcare environments are incredibly stressful, and they're difficult places to work, they're difficult places to be taken care of. and we need to do something to change that environment for all of the people that have to be there to make it better for them and better for their health overall. I think that our program is committed. We are in the process of developing a new wellness center, and part of that hinges on having a research coordinator who can help us track outcomes for what we're doing, demonstrate the benefit of it, and then be able to replicate that in other settings so that it's not just in our center that it happens that way. Because I think that is the kind of thing that will convince administrators that this is the way to do things, and will also convince insurance companies that it's worth paying for services. So ultimately, I think that this is the best path for everyone involved. I think that doing things in this way means that we can develop highly effective, patient-centered healthcare that addresses mind, body, and spirit to improve health. We can move toward a more preventive model so that we're doing more preventive care and less intensive care. We can become more cost-effective because we're not doing things that people don't need, and we're making sure that the treatments that we provide are being provided in an environment where the patient is more likely to respond to them, and we're creating a better working environment for the people who take care of other people too. So that's kind of the way I see it. I would be open to any of your comments or questions about that. I think that there are some really significant challenges in healthcare in America right now, but I'm actually very hopeful that we're sort of at a tipping point where things are going to be heading in a much better direction. I think it's going to be a little bit of a painful birth. I think that change is always difficult. There's always resistance to change. And it's hard to come up with new pathways and do things that haven't been done before. But I know that it's not going to be easy, but I'm very hopeful about what's going to happen in the next 2 and 5 and 10 years here. And I would also say that to me it's very important that in addition to hospital-based and hospital-based programs, it's very important to have places like this in the community too, because I think ultimately we will all work together. We will share patients, we will communicate with each other. It's not going to be this kind of world like it was in the past where you build these enormous, medical centers and that's where everybody has to go to get their care. Care should be close to where people are, and people should be able to access it easily. And so we need to have many centers, not just the hospital-based centers where care can be provided. And the more communication and the more interaction, the higher the quality will be in all of those places. So, I think that I don't think of us as competing with, I never have thought of us as competing with each other. I think that it's just a synergistic environment where we can all thrive. So, comments, questions? Any of that make any sense?
I always have a comment. When you lay out that 85% of all chronic diseases are caused by lifestyle choices, and then you look at all of the ways in which the medical system does not address it, does not deal with it, ignores it, tries to ignore the science about it, and it really seems obvious that the bottom line is the bottom line, and why integrative medicine isn't more integrated into medical care is because they haven't yet figured out how to make as much money from it as they currently do from the current system. Is that a fair criticism of why it's not being implemented faster?
I think that what medicine has evolved into in the United States is a business, and it's more effective as a business than as a method of taking care of people. So I think there is some truth to that. On the other hand, I think that what's happened in medicine, some of it has been completely unintentional. And what happens is that people are trained to do something about a problem. And what's happened with medical education is that the way that we train people to do something about a problem is to apply medications and procedures and surgery. And we're very slow to catch up on teaching about the importance of lifestyle behaviors. I mean, we've gotten it for years about cigarette smoking because the data was there, 20 years ago. But actually the decreasing health of our lifestyle and of our population has been happening so fast because of changes in the food industry and changes in the way people work and the way people live. You know, the poor health of our nation is not completely due to the inefficiency and ineffectiveness of the healthcare community. It's partly because the way we live as Americans just doesn't work very well. And when you look at other countries that are healthier, some of them have much more efficient healthcare, but they also have totally different lifestyles. Right. So, you know, if you live in Europe, you don't live 20 miles away from where you work, and you probably walk or take a bike to work, and you walk or take a bike to the things that you need to do, like get groceries or go to the post office or whatever. So it's just a totally different way of living. So I think a lot of what's happened in healthcare is unintentional, but certainly the financial incentives have always been more for doing things, you know, like procedures and surgery. And because physicians are so pressed for time in their offices, they're all on productivity scales now. In order to be paid, they have to see so many patients. And we don't have a lot of time. Even if you're a cardiologist and you know that lifestyle is important, it's easier to hand the patient a sheet that says, do this, than to actually spend time counseling, coaching, you know, learning motivational interviewing and all that kind of stuff. So a lot of it is unintentional. A lot of it is related to where the financial incentives are. But, you know, I just 2 weekends ago went to a lifestyle medicine conference at Harvard Medical School. And you know, it's a revolution that's taking place in medicine, and it's a small group of people now, but, you know, it's spreading and it's happening. And there were more people there this year than there were last year, and people could come back and report on the things that are different in their institution. So I do think that it's changing. And as I said, even the financial incentives are changing. And so we, you know, it won't be that way anymore, that the incentives are all for just doing the other stuff.
So it's heartening to see that there are doctors who are willing to turn away from the most expensive treatment to the ones that actually work the best. And I think as more individuals do that, we'll see the system changes.
Right. And I do think that it's a good thing that the law is going to move people in that direction, because that will make it happen a little faster than if, you know, it was just driven by the economics of the market. The other thing that I think you have to realize is that it's not just healthcare that's a problem. It's the person in the American public who often would rather take a pill than go for a walk or figure out how they're going to fit a little bit of stress management into their day. I mean, we are a people who, you know, our lifestyle is kind of revolves around consumption, and consumption means that we work a lot and we drive ourselves to do a lot so that we have money to consume things, and then we don't have any time left to take care of ourselves. And, you know, we have to effect a change on the part of the American public that, you know, this is an unsustainable, I mean, to me, it sometimes seems like Romans and their lead pipes. You know, if we keep living this way, we will, you know, face extinction. It just can't continue this way.
Well, doesn't it ring kind of hollow for a patient to sit there in an office of somebody who's too stressed, too time crunched to talk to them, and that doctor is supposed to give them advice about how to live a stress-free, you know, time easy lifestyle. So the doctors don't really have a lot of credibility either, but you're absolutely right. And then they're also faced with, I'm sure that, you know, 9/10 of the people that they would like to talk to about lifestyle won't even listen to them anyway. Totally.
One of the barriers to affecting lifestyle change in a patient, it's not just that the patient doesn't always have confidence that they can do it, but the doctor often believes that the patient isn't going to do it. And so you bring all that negative energy into a room and, you know, it doesn't go anywhere. So, you know, after going to this conference, I mean, I've always counseled patients about lifestyle changes throughout my entire practice. But I learned at this conference that I need to be better at, you know, motivational interviewing, because I'm not always coming at it in the right way. And I think that part of our role can be teaching other providers about how to be more effective in behavioral change, and how to take, like if the patient says, their level of confidence in being able to do something is 2 out of 10. The next question is not how do we get you to be a 3 or a 4 out of a 10, but tell me why you're not a 0 out of 10. You know what I mean? So you're working with what little they have and trying to build their confidence on that. That takes a lot of time. It takes a lot of coaching. You have to see people frequently. You have to spend time with them. I think for the near future, it's going to be people in my field that can spend the time. But eventually, we need to figure out a way, how does every doctor do that in their office? If they're not spending a half an hour coaching, who is the person in their office that's doing it? And how does that person get paid? Because right now, there's no reimbursement for health coaching, even though that's the most important thing that people need. You know, Highmark knows that's important. They have health coaches. But, you know, you need more than just telephonic health coaches too. You need face-to-face, one-on-one health coaching, and we need to figure out how to make that work financially, whatever the new environment is going to be. Other questions, comments?
The number of people who come to this clinic looking for a single magic medication that will help them with their anxiety or their depression or their bipolar symptoms is very, very high. But I think to an increasing extent, the number of people who, when they arrive here, know that counseling is an important component of what they need to cope with the underlying difficulties, that's increasing. And reluctance to commit to counseling, I think is beginning to subside. It's slow, but it's happening. Don't you feel that way?
Yeah, I think that, yeah, like yesterday morning, we were having a group here, and this place was packed with people. We were practically full. And from the inception to now, I have noticed that. I think it goes back to your comment. First, our own belief and our own practices are very important. I mean, if we read up a book and we start preaching, that doesn't work. That's where the negative energy comes into play. And our own beliefs that, you know, we can shift our own lives. And then, believing that our patients want to shift their life, they may not know that they can. Or the empowerment and the motivational, you know, kind of conceptual formulation. I think that people want to. Nobody's teaching them how to. And yet we have a large number of people who believe in a bottle and a Rite Aid, you know, that have now said it the wrong way then. And that bottle should be a banana. But I think that's shifting. Mere the fact that we have existed for 8 years speaks for that fact, even though, you know, mental health is the least reimbursed model in the nation. I mean, we don't value mental health.
Which is the exact opposite of what it should be.
Mm-hmm. And I mean, knee replacement can be done without research. But, you know, we'll be lucky to get a 45-minute session. You know, how many letters do you have written?
So many letters.
You know, those are the barriers. But I think that it's shifting, whether we like it or not, out of necessity. As Betsy said, you know, or else we will extinct ourselves, really will. I mean, that path is a path of self-destruction.
I may have said this in this setting before, but I look forward to the day, like I've always thought it was so bizarre that when you talk about health insurance, that you separate out behavioral health as somehow different than medical health, when they're so inextricably linked. That I look forward to the day when that kind of distinction doesn't even exist, that it's just inherently understood that behavioral health is part of mental health, is part of physical health, is part of physical well-being overall, and that there would never be any kind of differential coverage for anything. You know, and actually I look forward to a world where, you know, you don't even have to separate out disorders. I mean, of course, we still have to have specialists who can deal, you know, more with one thing than another. But, you know, I look forward to the day when the person's depression is not just one thing on the list of diagnoses, but, you know, is just considered to be part of the whole package, and whoever sees that person has to at least address it and recognize that it's part of what's going on. Because I think for so long, behavioral and mental health has been like this thing off in the corner that is seen as so different than everything else when, you know, it's so integral to everything else. And there's still such a stigma about it too. You know, people, I think part of the counseling thing is the stigma of, you know, even going into a building that has a sign on it that says, you know, psychology or psychiatry or whatever. The only good thing about what's happening in our society right now is that these disorders are so ubiquitous.
Right.
You know, it's almost like if you don't have depression or anxiety, you know, what's the problem?
You're not working hard enough.
So at least the commonality of it, I think, has helped take some of the stigma away from it. I mean, the antidepressants are, you know, I think right up there with pain medicine with the most highly prescribed drugs in the country.
It's ironic that insurance companies, you know, won't cover so many of the holistic things that we're trying to do, but they'll pay for like multi-$1,000 knee replacement without any, you know, like they'll pay for the more expensive treatments without even looking into cover something that's so cost efficient. It's like very ironic to me.
Yeah. And then we're always, I mean, there's not a day go by, we are struggling with between the 15-minute session and the 25-minute session and making sure the documentation is done well. It's a fear of, you know, even doing what we do so very rightfully, it creates that fear and the burden of, oh, what if they ask it, you know. I mean, in the mornings, a lot of time our meetings are spent trying to make sure that we spend enough time documenting what we're doing. But that is just the way it is. So I think that, you know, there are people who are taking a very brave approach, but a gentle, brave approach. Because we can become aggressive and very, you know, blaming, you know, the system. That doesn't work. I mean, that doesn't work in family interactions. It doesn't work, you know, the insurances are bad, you know. Well, there are people too. You know, your mom, dad, brothers, sisters are working in the insurance company. You know, your sister.
My sister and my husband works in Harvard.
You know, and there are people. Administrators are people. And I think it's important to recognize that it's our job to even educate the people who are serving in certain roles, whether they are in the political roles or the clinical roles or mother and father role, it doesn't matter. Because the education then breaks down the fears and begins to have a community conversation. And Betsy, like folks have been like the pioneers. You know, when I'm a more often word. I mean, there are people who really kind of live their life, you know, and they really have lived their life, and it was not even a fashionable thing to talk about these things. And university is an example of that. The very forefront of, you know, where the healthcare meets administration and the bustling, hustling, you know, sort of lives and so forth. And she's still living there, which is kind of very noble. People like me ran away and began to complain, you know, I can't stand it.
Well, I only do it part-time. No, but I mean, I think that's part of the challenge too, is trying to maintain your own health in a system like that. And I think that's why I feel so strongly about the efforts that we make for employee stress management and employee wellness, because, you know, I've been burned out and you know, felt that and had to step away from it for a little bit and had to, you know, sort of decrease the amount of toxic exposure. But you know, I think that there are ways that people can exist in that world and you know, make it work. But you know, it's tough for the people that are there every day, you know, full time and working long hours. And because I also I work a little bit in employee health at the hospital, and because I take care of people that work there, and you know, and I think this is true of any hospital, not just mine, but it's a tough environment right now. But you know, I think too about the more I learn about motivational interviewing, I can always use that on the administration too.
That is very true. That's actually very true. It's really bringing in the change. And people do change, just as knowing that these things take time. And you, I just wanted to highlight, Betsy and I were at a breakfast, and I was trying to, as usual, I said, "Oh, why don't you come here and work doing my little spiel?" And she said, "No, you're too far. I love you guys, but you're just too far. We don't need to work any more hours. And I just want to be able to have my walks in the morning. Can I share? It's not confidential, right?" And she said, I even when we went for the breakfast, she said, "Well, I just had my morning walk with my friend, and I walk around wherever the neighborhood is, and I have decided to cut back on my hours of work." So she stepped down from being the director of the place, and then she's okay with just being the staff physician. But knowing that it is important for her own well-being was very exciting. And I really kind of respect that a lot, because most physicians or clinicians don't owe up to their own vulnerabilities. They want to kind of stay very strong in appearances and get kind of be struggling inwards in their own lives. And I think that really kind of is such a noble. And we have even talked about having. I want to have you make a comment about, you said that you sometimes do the disability reviews, and how that you were saying that how more physicians are getting disabled.
Yeah, I don't do them anymore, but it's interesting. What used to happen in the past is that physicians were a really excellent disability insurance risk because they were highly motivated to work and they had fairly healthy lifestyles, and they almost never utilized their disability insurance. So they would pay year after year after year and never get any benefits. So of course the insurance company was thrilled. And what's happened now is that physicians have become a much poorer risk because their job satisfaction is so low that they're leaving medicine, and sometimes they're leaving medicine because of what they perceive of as disability. And it's even interesting to me that a lot of times the disability is for a condition like fibromyalgia or chronic fatigue, which physicians traditionally in the past would tell me they didn't even think existed. So it's just interesting the way physician job satisfaction has really decreased, and it's just such a different world. I think a lot of physicians feel like they don't have any control over what's going on. Because everything is driven kind of by the financial, system, and hopefully physicians will feel a little bit more empowered as things go forward, to be able to do things that are really the best things for their patients. But right now the system is, everything is just about how much you produce and how much you make, and the physicians go to school for a long time, and they put a lot of effort into getting their education and their expertise and ability, and so they should be reimbursed at a decent rate for what they do. But I think that a lot of the money in healthcare goes to companies that are making the medications and providing the equipment, and it's not really going to the people that do the care. A lot of physicians, in fact, the ones that spend the most time like face-to-face with the patient, are not paid very well at all for what they do. And that's why more people tend to go into the specialties where they can do procedures and things that generate more money.
And that has a trickle effect to the whole. I really think that the most crunched folks are the nurses. And the nurses in the hospitals are probably the most, at least we have a lot more nurses than even our own treatment here, because they're getting longer hours, more expectations, and
more difficult
patients and all that kind of stuff. So in all of that is hope, because when things really get bad, things get better. And really kind of feel, that there's so much of potential and then doing something which is so very hopeful. And I also believe that, that we are at a tipping point of how the healthcare awareness is continuing to grow. And I'll finish this conversation by a comment. I was in a dinner meeting at a place where there's a surgeon, there's a pharmacist, there's 2 primary care docs and all that. And somehow or the other, generally in those settings, the healthcare is never a conversation. We talk about politics and this and that. And I don't know how it began to get into that conversation. And every single person made the same comment. They said, I wish I had more time to spend with my patients. And I don't. And one even went up to say, it's almost like criminal for how I'm functioning. He said, but I don't have the choice. I keep on pushing myself to surgeries and things, and even the family's expectations, Sometimes he said, the families don't want their family members to get health care. So I don't know how to deal with that. So there's many dimensions to this whole conversation. But with that said, the reason I want to thank Betsy for taking the time out of her life to be able to join us. And while she's still here, I want to kind of also make some observations. You should notice that we have people come in and give us their wisdom, right? We also need to share our wisdoms and extend ourselves outwards as well. It's only fair for us to kind of spend our time as Betsy is doing here. She must have taken her block of time and planned it to talk to us, right? And this is not the first time she has done that. I mean, in the past, I would say, even the past few months, she's here for our conference. How much did you get paid? Not a single. I mean, we are so very useless creatures. We don't even pay the people we like.
No wonder she doesn't want to work here.
But it's her that desire to be helpful. It's just that inner motivation of a human being. And the reason I'm kind of highlighting that is, if we didn't have that kind of a thinking model, she could have easily seen more patients someplace and done no driving and be in a comfortable space of her own, right? And then she chose to come for our conference. She chose to come here to give us this conversation and her wisdom. It's our moral responsibility as well. We cannot say, I mean, she can hide behind the fact that she has children, right? Well, we all have children. We all have those moral, personal responsibilities. So basically speaking, I'm motivating us to recognize that it just isn't that we have a church to go to, we have a home to go to, we have children to take care of. This is more than just business. It's a societal issue. It's a community matter. And then, if somebody's driving out there who's drunk and has used drugs that we're prescribing, that could be a liability for my son. You shouldn't think that it's going to affect somebody else. So this community education is part of our, I would say, moral obligation. And it's important that we see that from that eye and say, yes, I can do my job. Yes, I can do my things which are personal to me, but I need to also spend myself in a place where I can do things for others who I don't even know. Right? Betsy doesn't even know half of us who are sitting here. But it doesn't matter to her. And that's very important that we kind of design those kind of thinking processes. Why am I setting up that stage is because I have an agenda. A psychiatrist never does things without an agenda. So I'm going to send these things around. A few on this side, a couple on this side, and they will come around. Because we have few matters which are coming up, and sometimes I feel the most on this side. So I just want to kind of highlight some of the things that we do over